I'm Peter Nagi. I'm the medical director of the pain clinic at UAB Highlands. So we are a comprehensive pain clinic, and we offer evaluation and treatment of patients with everything from acute to chronic pain in every part or any part of their body. The goal of our clinic at UAB Highlands is to provide the highest quality care for our patients. We have subspecialty experts in our field. We have subspecialists in back pain, neck pain, pelvic pain, complex regional pain syndrome, cancer pain, trauma type pain. These are all specialties, subspecialties within pain that allow us to provide the highest level of care available. Most importantly, we want to partner with our referring physicians. They're an important part of the patient's overall care, and in order to establish continuity of care, we need to communicate and make sure that our treatment plans are the best option for our patients. Our patients need to understand what their treatment options are and what their diagnosis is. This allows them to be engaged in the process of getting better and ensures the most successful outcome. The UAB Pain Clinic will offer patients a comprehensive and multidisciplinary evaluation of their pain problem. We have 9 anesthesiologists that are all board certified in pain. We also have a nurse practitioner, 3 pain fellows that we work with, 2 pain psychologists, and we all are a team. We work together and make sure we provide the best care that we can for patients. We also have 6 full-time nurses there. We have a radiology tech and 4 clerical staff that help us get patients, make sure their patient's experience is a positive one. Also, our facilities at UAB Highland have recently undergone a major renovation, so our patient's experience is a positive one from the time they step foot in the door. Also, a nice thing about UAB Highlands is that on site we have a host of different subspecialists. We have rheumatologists, orthopedists, physical medicine and rehab doctors, neurologists that are all nearby, and it's nice to have consultants that we frequently interact with nearby, so we can ask questions when we have concerns or even refer patients back and forth. We have physical therapy and occupational therapy right there in the building on the first floor, which is a big component of our patients' care plans. And then most patients enjoy the easy parking at UAB Highlands. So. At UAB Highlands Pain Clinic, our primary focus is interventional therapies, but we do understand that most patients will need a multidisciplinary approach in order to get the best outcomes. So in addition to providing interventions that are specific for the patient's problem, we also coordinate physical therapy to begin immediately following intervention. And we also will review the patient's medications with them, make sure that they're on a multimodal regimen of medications so that when they leave our clinic, they have a care plan that will be the most effective for them. Our pain clinic at UAB is unique because of our faculty and our facilities. First, our leadership is dedicated to providing us the best facilities possible. We have high-resolution fluoroscopy, we have ultrasound capability, and right at UAB Highlands we have ultrasound, MRI, CT scanners all available to us to help us diagnose patients appropriately. When we perform procedures, we use the high-resolution fluoroscopy to target these injections. We use digital subtraction to be sure that we're giving this safely and it's not intravascular. Patients know right away if their pain is getting better. We use local anesthetic as a diagnostic tool as we're injecting in the steroid. It gives them the therapeutic effect. And so we get both of those benefits from doing these injections. And throughout the entire procedure, we have a nurse that's with the patient, making sure they're comfortable throughout. our faculty are committed to finding newer and better solutions for our patients' pain problems. For example, Ryan Almeida is one of our interventional pain faculty. He was the first in the state of Alabama to implant a MRI-compatible spinal cord stimulator, which is a technology that can really help with a patient's pain when they have persistent post-laminectomy pain or nerve injury type pain. Also, the MRI compatibility is a very important feature, because if down the line the patient has a suspicious lesion or another problem and need an MRI, we don't want to limit their options down the road. Another of our faculty, Dr. Tim Ness, is a renowned researcher in abdominal or visceral type pain. He's been published 150 times for studies he's been collaborating on. He's also been awarded 25 research grants. This is the type of expertise that helps us translate the newest information into clinical care for our patients, and we feel they benefit from that. We are collecting data from all of our patients, their outcomes. We have a nurse who calls patients after they've been seen in our clinic, after they've had an interventional procedure, and is documenting not only their pain scores but also their functional status and how they do, how their quality of life has been affected by this intervention. And this, we feel, is going to be an important way for us to determine what are the best options for our patients, which treatments worked, which ones didn't work as well as we hoped, and let us cater to those that are most effective and stop delivering care if it's not making our patients better.